and yesterday and the day before, we were looking at a number of various conditions. Yesterday we were appreciating things to do more with the musculoskeletal disorders. And in these, we are looking at basically the prevalence and the impact and the places which are more constrained by these musculoskeletal disorders. We appreciated that these musculoskeletal disorders are more to do with the muscles, the joints, the hips, and the lower limbs, the upper limbs, the neck, and etc. But we also saw the causes, it being multifactorial. Things to do with the physical causes, the handling of heavy loads, repetitive forceful movements, and etc. We appreciated a different number of them and types of these musculoskeletal disorders, things to do with the arthritis, where we saw the rheumatoid arthritis, which is autoimmune inflammatory disorder affecting joints and etc. But also we came and appreciated that there are other forms of these musculoskeletal disorders such as osteoarthritis, which is the degenerative disease where we're looking at it being the wear and tear in the joints. Also, we saw the different symptoms and the causes of this, and we saw that age really is a primary contributing factor in those over 50 years of age that will be experiencing osteoarthritis. However, we understood that osteoarthritis is quite different from osteoporosis, which could always be confused. But when we talk about osteoporosis, we're looking at the decrease in bone density, leading to low bone mass and thus increasing bone fragility or susceptibility to getting those fractures commonly TC. We realized that other key factors for osteoporosis were the genetics, the lack of exercises. It still played a contributing factor. Cessation of smoking or tobacco smoking, and also we're looking at calcium and vitamin D requirements in most of these musculoskeletal disorders. We also saw things to do with osteomalacia, and we saw what are the roles of what are the roles that diet plays in this. All right, today we are going to interest ourselves with the nutrition management of cancer and the cancer origins, because this is really this is one of the common conditions, or one of the most common illnesses, or call it a disease, that you will find in your place of work. Okay, yeah. Really, by the end of this engagement, we expect you to identify the key nutrients and their roles in cancer prevention, treatment, and recovery. We also explain that we expect you to be able to detail the use of the nutrition supplements in cancer patients, the importance of these evidence-based recommendations. We also expect you to understand the ethical considerations and the potential risks associated with the dietary interventions for these cancer patients. But really, also at the end of this engagement, we will have a look at the nutrition care pathway or the nutrition care process a bit in detail. I understand we had looked at it briefly in our previous engagements, but today we are going to be in position to kind of appreciate what it looks like broadly. And also, we expect you as a nutritionist or as a dietitian or as a student in this field to be able to identify the resources and the support systems that are available to help cancer patients manage their nutrition status, and also their recommended dietary allowance, or their RDAs, I should say. So when we talk about cancer, this is not something strange. Really, everyone has heard about cancer, and we are looking at this being a broad term that encompasses all a group of diseases that result to uncontrolled growth and spread of abnormal cells. And you will realize that there are two various forms of these. Here we are looking at the cells deviate from their usual pattern of growth or development, and there is increased cellular division, or what you people call mitosis. Okay, yeah. So forming masses called tumors, or other people have called it binary fusion and all those other things. So there are two types of tumors where we have the benign tumors. We are saying these remain localized. When we talk of localized, we are saying these do not. We would have used the word move or locomote, but really they are not attacking various places. Okay, these remain only in that area. For example, if it is cancer of the let's say cancer that has attacked your let's say the leg, it only remains at that particular point, and you are not going to see it moving, particularly from one place to another. And we are looking at this that it does not invade the surrounding tissues or spread to the different parts of the body. And really, we will appreciate that for these benign tumors or these benign cancers, really the only form of treatment is surgery or surgical procedures, whereby now they can remove that place where they are localized. And then you have also seen amputations taking place. Then when we talk of malicious tumors, also what people call the malignant cancers, these have potential to invade, posing a significant threat to health. Or what started as a smaller benign swelling in that localized place, then it starts to move or invade other places. We will see a different term that we give to movement or spread of these various cancers. And really, most of these uncontrolled cellular growth will require a lot of energy. Remember, cells depend on energy, and also there will be requirement for cellular respiration. However, now they have grown a lot in volume, but really we could talk of other things or other factors that really contribute to these. Okay. Yes. So, what are the characteristics of cancer? When we talk of the characteristics, what are cancers known for? Okay. Yeah. So, when we begin by talking about cancer, first and foremost, we are talking of this uncontrolled cellular growth. And here we look at these cells being able to divide and also grow in number uncontrollably. Okay. And this the division that is not regulated is one of the characteristics. And then when we talk about tissue invasion, or you could call it metastasis, when we say a cancer has metastasized, that means that it has moved from a place where it originally was, and now we are starting to see also abnormal cellular growth. Because if there is abnormal cellular growth in one point of that tissue, then we tend to see if it is malignant, or if it is not benign like we saw earlier on in our previous slide, then we'll expect these cancers to move. Okay, so these cancers can invade those nearby tissues and organs. We know that the tissues are the ones that are responsible for forming the organs. And once this happens, we expect there will be disrupting the normal functionality of those parts. Okay, yeah, forming also secondary tumors and etc. Until we look at a total destruction of those particular organs that are now where the cancerous cells are growing. Also, there are abnormal phenotypes, or what we call genetic alterations, and we are saying here. Cancer often arises from these mutations that disrupt the normal functioning of genes that are responsible for cellular growth. Okay, yeah, and also those same genes that are responsible for one, the cellular growth, the division, and also the repair. So these mutations can be from lifestyle choices. Also, these could be from the uh, uh, this could also be from the environment. Okay, yeah, a number of things that we can see there. Also, if we are talking of characteristics of these cancers, we can't cease to talk about the signs and symptoms of cancer, which we will see later. But really, to appreciate, we could talk of the lumps, we could talk of the abnormal bleeding. Also, unexplained weight loss could be a sign of cancer, and also changes in both the bowel and blood habits in the way we excrete, and also fatigue could be coupled. There are a lot of things that we could talk about. Also, we have the microenvironments of cancer. Okay, those immune cells, the blood vessels, and etc. All these play a role in cancer growth. So, friends, I think that is what we have covered. When those when those when those characteristics are present, for example, in a case, we start to suspect that there could be a cancer developing in these cells. But then also we could talk of we see an increased energy requirement, because now the energy is required for functionality of these other cells. That's what really contributes to cellular loss. Okay, or what contributes to weight loss, I should say. So, what are the stages of cancer? When we talk of cancer, we are looking at its development occurring in three stages. We have the initiation, we have the promotion, and the progression. Okay, yeah. When we talk of the initiation, really, we are looking at the initial genetic alterations in a cell that it makes prone to becoming cancerous. Okay, yeah. And then when we talk of the promotion, we are looking at the further stimulation of these altered cells, leading to their replication or division or growth. You could find also various literature talking of stage one, stage two, stage three, and other people have also talked of stage four. But really, we are looking at in stage one, the initiation phase, where we are still looking at genetic alterations, failure for the body to control cellular growth or cell division, and etc. And also, even people have argued that remember, some cells need to be specialized at the end of the day, or some need also to be destroyed. But then some of these are left undestroyed or undamaged, then it will lead to overall increase, leading to this cancer. So when we talk of promotion, really, we are looking at having further stimulation of these altered cells, leading to replication. But for progression, we are looking at development of a tumor and its potential spread or metastasis to the other parts. And this is considered really in a more stage three, where we are looking at it being regionally advanced. Okay, these large tumors spreading to all those other parts, maybe in the lymph nodes and etc. And when we talk of this progression, also we are looking at it going to other distant organs or tissues, indicating this. And what we could talk of these stages of cancer, really, when you go to read, you'll find that there are different stagings of these cancers, depending on what the writer wants you to understand. But really, we want you to understand that the first is alteration of the genetic alterations. Then the second is big promotion, further stimulating these altered cells to grow, maybe abnormally, or they could be also abnormal shape. Okay, the abnormal shape of the cancer cells, or also increase growth. Okay, yeah, that is also true. Then when we talk of the progression, we are really looking at metastasis, or the moving of cancers for all these cells from one localization to another. Okay, yeah. So right now, let's look at the signs and symptoms of cancer. Okay, and these are really more noticeable. And when we talk of the early stage cancers, often have no noticeable symptoms. So we tend to say that in the early stages of cancer, cancer is asymptomatic. You can never know that you have these cells growing in you. Okay. However, as the disease progresses, we start to see signs and symptoms of this. Okay, yeah, like you had see, we had talked about most of them, but some of these common we are looking at as the disease progresses. Most of these symptoms will manifest depending on the various organisms affected, and also to the extent of the spread, to which extent has this cancer have been spreading. And also, what when we talk of these common symptoms, like so, the weight changes, really in most cases it is the weight loss. When we talk of fatigue, we are looking at that always you're feeling weak, you're feeling irritable. Even if you try to sleep, the sleep does not improve, or it does not relieve your fatigue. Then we are talking of persistent coughs and also unexplained pain. Sometimes people try to report that some specific areas in the body tend to lead to pains coming from the bone. Okay, for example, people who have bone cancer tend to report this. Also, people undergo skin changes where the colors and the textures of the skin tend to change, and also the sores that do not heal. For people with cancer, some people could even confuse them with having HIV and HIV/AIDS. Okay, yeah, because most of these symptoms could show that maybe this person is having one of those is having viruses or having HIV AIDS. When we talk of difficulty in breathing, we also talk of the difficulty in swallowing, and also changes in appetite. And these changes in appetite leading to that feeling of fullness, and also a loss of appetite. Even this could lead to inadequate intake. And when we look at inadequate intake, we really think of we really try as much as possible to think of underweight or weight loss to using the protein. Once the proteins are being used, we'll see this person wasted and malnourished. So when we talk of the etiology or the cause or something like that of cancer, really here we are looking at what leads to cancer. Okay. However, there could be this could be multifactorial, as most of the things we've seen, but then different factors contribute to this. And one, we had looked at the genetic mutations. Okay, so these could be inherited from parents, or if there is family history of cancer, chances are many that this could also be present in an individual after who comes after in that line. And also some happen at birth, and also we are looking at exposure to carcinogens. Okay, and these include the chemicals that we find in the tobacco smoke, the asbestos, the radiations. People who are talking of the skin cancer, we are looking at those radiations from the sun, or the ultraviolet radiations. That is why, back then people used to say that Africans do not get skin cancer, but it looks true. We do not get skin cancer from overexposure to the sun, but the whites do get it, and that is where we need to appreciate our melanin. However much people always tell us that we are very dark, but we really have this advantage that we do not walk around putting on sunscreens. But really, some Africans who are in those countries, for example, there are also African Americans who are now in those countries, the Americas and etc. Also, they're having these challenges of skin cancer. Really, it used to be more to do with African origin. This is where I would like to implore you people to go and advise the women we have right now. And actually, even men are now fond of bleaching, using those bleaching agents and bleaching chemicals that soon give them the skin cancers. Okay. Yeah, so this is where you need to come in and try as much as possible to advocate for people to leave the skins the way they are. Do not bleach for anyone. And what surprises me most is, even after someone has seen that the chemical or whatever it is, the Vaseline they tend to use here to bleach is over called Carolite. Yeah, that chemical, once someone has used it to bleach, they are going to turn purple and whatever colors that will come. But then you will see that the neighbor will want to use it again. Actually, some people have taken it further and have started actually injecting themselves with the injections that tend to deplete melanin of the body. You will go and read about most of those bleaching agents and bleaching creams, but really they do a disservice to us and will lead to all different forms of cancers happening. When we talk of tobacco use, that is key. Okay? Yeah, the carcinogenic compounds in tobacco. When we talk of carcinogens, these are compounds that are capable of resulting in mutations, okay, of the cells, yeah, leading to the abnormal cell growth and cell division. lastly leading to cancer. And also we talk of excess body fat is associated with risk of developing certain types of cancer, as well as other chronic diseases such as the heart disease, the diabetes, the hypertension, etc. But you remember when we were looking yesterday at arthritis, we saw that weight people with excess body fat and body weight tend to overwork or overload the joints and etc., leading to arthritis. And these inflammations are really most of the things that could later, maybe if modified with the different mutations that are happening due to environmental exposure or due to a particular sickness that you could get from a virus, this could result into a mutation, and at the end of the day we see a cancer developing, etc. Remembering the story that I told you of a colleague we lost at school yesterday. Lifestyle choices, when we talk of these lifestyle choices, we are looking at including diet, physical activity, maintaining optimum body weight or the normal body weight. And also we are saying this can significantly impact the cancer risk. Okay. Yeah. For example, maintaining a healthy weight and consuming those foods that are rich in fruits and vegetables and engaging in regular physical activity can help reduce a risk of certain cancers. Also, when we talk of lifestyle choices, this is when we talk of the cessation of alcohol. This is where we talk of the cessation of tobacco smoking, because one, alcohol could lead to liver damage and lead to cancers of the liver. Or then when we talk of the cessation of smoking, we are looking at lung cancer happening, and those are most of the, actually when we talk over the lung cancers happening, we understand that now this is more of a public health concern. Also, we could talk of the manufacturing plants where these are releasing fumes and also hazardous waste into the atmosphere, leading to the population succumbing to cancer and all those other various forms. When we talk of diagnostic procedures, what are we looking at? Really, we are looking at how could you confirm, okay, beyond doubt, that a person could have cancer. We saw some of the signs and symptoms, but really, you as a healthcare provider, you must be able to understand most of these diagnostic procedures. So we could talk of the blood tests and also the physical tests. When we talk of the physical tests, we are looking at you clinically examining the individual, and also this is where we will talk of the taking the history, okay, the medical history of a client, and also asking about family history. Remember when we talked of the genesis, the genesis of the cancer being a little bit genetic in nature. And so through most of these, you will be able to perform an assessment in search of the things. For example, for people with breast cancer, we tend to feel that lump within, okay, yeah, within the breast. If I caught it right, you will feel that lump, and then once it is worked on early, then there are chances of many that really this cancer of the breast will be avoided. People have talked about using men as one of the key interventions that have. It's not. I'm not encouraging men to go touching every breast they find, but really, one study showed that if men are empowered to understand how to diagnose for breast cancer by feeling those lumps in the women's breasts wherever they are. Remember, in most cases in our African settings, it is one man and 5 women, or one man and 6 women. And men could be a key identifier, but that is a story for another day, or a discussion for another day. But really, now this is more to do with physical tests and etc. If someone can feel those masses or those abnormalities, really they could indicate that you could be having cancer cells developing in you. Then when we come to imaging tests, this we are looking at the CT scans, the medical resonance imagery scans, the ultrasound, the X-rays, and etc. These can help us see those organs that we do not, that we cannot see, those internal organs, the tissues, and also this could help us detect those tumors. For example, there is no way we can talk of a brain tumor without understanding, without using these x-rays and etc. So this can help us identify basically most of the things to do with where it is located, how big is it, how is it going to spread from one place to another. Okay, yeah. And then when we talk of biochemical analysis, this is where we talk of the biopsies and etc, where there is a small sample is removed from an area, but also really sometimes put under microscopes, but I also sometimes put in different solutions to give us this. And also really also when we talk of the tumor classification or the TNM staging, really we are looking at once diagnosis is confirmed here, we determine to the extent at which the disease is, and this will guide on the treatment, whether there will be a requirement for surgery or chemotherapy and all those other things. So when we talk of the interventions during treatment, so we are talking of individualized medical and nutrition therapy during chemotherapy, radiation, tailored on nutrition plans and nutrition plans to optimize intake, uh, uh, and absorption. Okay, yeah. When we talk of this chemotherapy is a little bit challenging. Okay, yeah, we understand that here we are trying as much as possible to kill, okay, all those cancer producing cells or the cancerous cells or the tumors that the person has within them. So what we are looking at really in this chemotherapy, really, first of all, there are what we call these pre-chemo diets that we need to uh, prescribed to the individual. Okay, so the nutrition will play a key role in this chemotherapy, and it will help us eliminate most of the side effects. For people with chemotherapy, for people undergoing chemotherapy treatment, most of these people have have reported a loss of appetite. Okay, and also having dietary guidelines for patients who are undergoing this chemotherapy. We are talking of eating the nutrient-rich foods, or what we call a balanced diet in a layman's language, and trying as much as possible to manage those common side effects, things to do with the mouth sores, things to do with diarrhea, things to do with the vomiting, and etc. However, these are the modalities of cancer as we are looking at. What I had forgotten under chemotherapy, still this is where we talk of the eating the small frequent meals. Okay, instead of those large meals, we are looking at you giving that individual these small frequent meals throughout the day, also being able to choose those foods that the individual likes most. Okay, so as to increase the intake of these particular foods, but we are also looking at you including those protein rich foods for basically the tissue repair. We've talked about including protein rich foods in almost all. Okay, unless for maybe the condition that we've talked of limiting protein is in kidney disease and also liver disease, I should say. But for the other things, mostly we are looking at also even in kidney disease and liver disease, we are not saying cease intake of protein. We are saying give proteins gradually, assessing the different requirements and the different needs of these. Okay, more to understand chemotherapy, we're looking at this as a systemic treatment. Okay, we are saying it affects the whole body and it can eradicate the cancer cells, control the tumor size and spread, and also alleviate these symptoms. Okay, chemotherapy classes include DNA replication targeting and controlled proliferation targeting, hormonal therapies, macromolecules, and for the side effects, we are looking at neutropenia. We are looking at when we talk of neutropenia, really here we are looking at a condition that looks at the low levels of the neutrophils. Okay, a type of these are white blood, these white blood cells. Really, that is when we are talking of the neutropenia. When we talk of the thrombocytopenia, we are looking at the low levels of these thrombocytes, and also the anemia, the diarrhea, the mucositis, the alopecia. When we talk of the alopecia, you remember what we are talking of. When we say alopecia, we are looking at people losing their hair. In most cases, when you see these cancer patients, you're seeing them without the hair. When we talk of the cardiotoxicity, we are looking at toxic substances being able to enter the cardiac region or the heart. But then when we talk of neurotoxicity, we are looking at toxins or the different damage or dysfunction that happens in the nervous system due to exposure of these toxic substances or the medications that are coming from this chemotherapy. I should say, though, when we talk of this neurotoxicity, also things to do with alcohol intake and also other drugs, not only chemotherapy, but also other drugs could lead to this. Yeah, could lead to this neurotoxicity, I should say. So when we are looking at this chemotherapy in our different clients that we have, we want to try as much as possible to maintain a clean environment at home, and also find ways in which we could make this person's life more and more. What should I say? More and more comfortable. Okay, yeah. Also, when we are talking of these chemotherapies, we have this adjuvant therapy, or what we call the really the adjuvant therapy. When we talk about this, here this is administered after or before the surgery, respectively, to improve the client's outcomes, I should say. For this adjuvant therapy, here we are looking at those different approaches. Okay, yeah. So we are trying as much as possible to reduce the risk of cancer reoccurrence. Okay, yeah, and also eradicate or remove all those other cells that could remain, the cancerous cells that could be left or could be missed out. So these are the forms of the chemotherapy that we are trying to look at. Okay, so it is most of this form of adjuvant therapy is recommended for patients with high risks of reoccurrences of cancer, and also things to do with tumor size, etc. When we talk of this new adjuvant therapy, we are looking at that therapy that is given before treatment or before the surgery, with the goal of reducing the tumor. For example, if it's a brain tumor, there are some sizes that cannot be removed surgically. Okay, yeah. So what they do is try as much as possible to put you under most of these therapies or the radiations or the hormonal therapy targeted at only reducing that, so that then it can be extracted surgically before it spreads to the lymph nodes and all those things. In case to note, this is a client who I got from the website or the search engine. But really, this is one of the cancer patients that was suffering with cancer of the liver, okay, or what people term as a hepatic cancer. Okay, so we are going to see, if you're seeing down here, you can see that this is the surgery happened during this person's stay in the health facility or in the hospital. So now let's introduce ourselves to surgery in cancer treatment. Okay, this is one of the key common ones. We have seen chemotherapy, but we could also appreciate the role of surgery in cancer treatment. And you're saying this is one of the oldest forms of cancer treatment and is essential for diagnosing and also staging the cancer. Remember, when we talked of staging, we are looking at more to do with the classification. Is it in a form of metastasizing? What of the sizes and etc. Okay. Really, more than half of all the cancer patients undergo cancer-related surgery, and also we are seeing certain cancers such as the head, neck, stomach, and bowel cancers may lead to malnutrition prior to surgery. So this will necessitate us to indicate more nutrients into the body, so as to have these interventions to improve the outcomes. So, friends, this is why I need to remind us that if we are preparing a particular client for surgery, we need to take into account that even after a month, this person might not be able to take in things orally. So this is where our enteral nutrition comes in, our parenteral nutrition also comes in. Okay. Yeah, but really, what we could talk of under these surgeries, we are looking at removal of these tumors. We are looking at also being able to stage these different cancers, and also this will help us in staging the cancers, like I said, but also relieving the symptoms in these cancer cases. Okay, so let's shift and look at radiation in cancer therapy, okay, or in cancer treatment. Here we are looking at using the radiations, okay, and it has been found to be a common and effective way to treat cancer or to try and manage cancer. We are using high energy radiations and beams to target and destroy these particular cells, okay. So the side effects depend on the radiation dose, the duration of the radiation, the site, and this may increase when the radiation is combined with other oncological therapies like the chemotherapy. With all the disadvantages that all the side effects, we could not call them disadvantages because this is one of the most common interventions that we have regarding the cancer. But we could see some of the side effects of chemotherapy. But if we couple it with radiotherapy, then different side effects could offset. And then a number of them are there. We will interest yourselves and read further. We have the external beam radiation, the internal, the systemic, but really most of these are to do with the cure. Okay, so radiation of the different parts of the body can cause nutrition related effects such as anorexia, which we know well, and also alterations in the taste, the smell, the dysphagia, where we are looking at the person not wanting to eat or swallow or intake, and then the diarrhea could happen, and also fatigue. All these are things that will impair a person's intake and also impact on their nutritional status. And this is what we need as much as possible to look out for as people in the nutrition or the dietetics part of it. So when we talk of the immunotherapy, we are looking at this being, when we talk of immunotherapy, I remember if you were around yesterday, we were looking at immunotherapy in rheumatoid arthritis, okay? Yeah, and also the other forms of arthritis, where here we are looking at this being a biological therapy in which we are using the power of the body's immune system to fight cancer. Remember, cancer, we are looking at the abnormal cell growth. Okay, unlike these other things to do with the radiations, to do with the chemotherapy, here we're looking at trying as much as possible to use what the body has naturally, and this will help us respond better and also reprogram the body in fighting against these cancers. You know, these cancers have claimed a lot of very many celebrities, the likes of Bob Marley, the likes of Michael Jackson, and etc. But really, one of the case in point could be Bob Marley, who refused to undergo chemotherapy and opted for a nutrition-based or herbal intervention, which okay, didn't work out well, but it claimed his life. But really, when we talk of the immunotherapy, we are trying as much as possible to use the body to destroy these cancer cells, and it has been found to be a little effective in some instances. For example, in most cases, we're looking at checkpoint inhibitors. Other people are trying as much as possible to make different antibodies and etc. Okay, yeah. So these are certain proteins such as the cytokines Also, this can boost the immune response against these cancer cells, and this is where people have also talked of using autoimmunity. If you remember, autoimmunity using the body to fight itself. So in these cases where now we have cancer, we want the body to help us fight those cancer-causing agents of the cancerous cells. So we could maybe, if we could find a way of tuning the body to fight those particular cells, then it would be key. But the problem is what would happen at the end of the day. Okay, the body has finished fighting those cells. Okay, the abnormal cells. What next? Okay, what next? What if it starts fighting the other cells of that particular area, etc.? But it's a research topic, and people are trying to do a lot of studies around it, and etc. But though we need to understand that most of these can be indicated for the kidney cancers, the bladder cancers, and etc. But then sometimes it is not indicated. While it could be good, there could be things to do with the skin rash, the colitis, like we saw, and also hepatitis could happen if not well managed. All right, so the importance of nutrition interventions in cancer. Uh, Nutrition interventions such as the oral supplements, the enteral and parenteral feeding, and also the dietary modifications can help improve nutrient delivery into the system, and also tolerance to these anti-neoplastic regimens, and prevent weight loss and malnutrition. So addressing the nutrition-related issues is really a key in optimizing the treatment outcomes, and also promoting a recovery of these cancer patients. Okay. So further, when we are looking at this, we are looking at cancer as being profoundly to affect the individual's nutrition status. When we look at malnutrition here in cancer, we are looking at the weight loss, we are looking at the poor wound healing, the electrolyte imbalance, the depressed immune function, and also the increased morbidity or sickness and mortality, which could be the death. And this is a significant concern in the treatment. Okay, yeah, and one of the reasons why earlier on. Really, this is a more similar slide. But then when we come to cancer cachexia, you remember when we talked of cachexia, we're looking at progressive weight loss and depletion of the lean body mass, often leading to death. Okay, so unlike simple starvation, here we are looking at cachexia involving profound weight loss. Okay, but for the simple starvation, we are looking at it being a little bit gradual or until those late stages. But here, the cancer cachexia, we're looking at profound weight loss and loss of muscle tissue, and even in the individuals who appear to consume enough calories, still we will see these people appearing vested. When we talk of the nutrition challenges in cancer patients, this could be various. The increased weight loss, the decreased appetite, the malabsorption, the nutrient deficiencies, really. And when we talk of nutrient deficiencies, I think these you know, and you could also interest yourselves to go and read about most of them. And these challenges can impact the body's ability to fight cancer and also tolerate the treatments like we saw, because also the treatments themselves will also have their own side effects and etc. So supplementation aims to address these challenges. So we are going to be looking at what could supplementation help us in cancer. So this could help us in mitigating these nutrition deficiencies. Remember now the person has a poor appetite and also malabsorption is happening, and also we tend to see that the individual is also having nausea. People report metallic taste and etc. So this supplementation could help us that in these small frequent meals that we are indicating for a particular client. Is this person able to get those particular nutrients, or is this person able to get those nutrients that they cannot be getting from the food naturally? Okay, yeah, this is where the supplementation comes in. So certain nutrients such as the antioxidants, the vitamin C, E, and selenium, the omega-3 fatty acids, these have been coming up key in most of our conditions that we've been discussing. And also addition supplementation, the specific nutrients to help in the treatment related side effects, the things to do with the neuropathy, the fatigue, and etc. So the considerations and the limitations, or what we call the caveats. While supplementation shows a promise in cancer care, it is essential really to approach this cautiously, as some of these supplements may interact with the treatments, causing affecting the efficacy. When we talk of the efficacy, we are looking at the overall goal or the proper functionality of that particular treatment, be it chemotherapy or be it radiation, causing adverse effects. For example, if maybe this is a case to point, I don't know how true it could be or may not, but giving an example, if we give a supplement that is high in zinc and then the radiations, these nutrients are then radiated or something like that, could lead to more mutations happening. And if more mutations happen, then we tend to have different cancers that we can't even manage. So, moreover, excessive intake of certain nutrients may have unintended consequences, even promote tumor growth in some cases. This we have talked of. So, friends, we have looked at a lot to do with the cancers, really. Okay, yeah. But now, let's look at the nutrition care process, like I had promised us in the next three slides, and we call it an evening. Really, when we talk of the nutrition care process, we're looking at you gathering the medical, nutrition care process. We're looking at this being a systematic, step-by-step process that helps us standardize the nutrition care or delivery of nutrition care to the clients that we are having, etc. Uh, the forms, remember the nutrition assessment, remember the nutrition diagnosis, remember the nutrition intervention, and also the nutrition evaluation and monitoring. Okay, yeah. But then, case to note here, we're looking at the first one being the nutrition assessment. And in this, we are looking at you being able to gather the medical history and also assess for their dietary intake, do the anthropometric measurements. Remember the different anthropometric measurements we are doing, the weight, the height, the BMI. We were doing the mid upper arm circumference. We were also able to do the weight circumference and etc. Okay, yeah. Also for these screening tools, that for the screening tools, you will see most of them will be having these measurements. Okay, they will be having all these indicators for you to tick on. For example, the malnutrition universal screening tools, the MAS, then also the malnutrition screening tool, the MST. But then you will also see the mini nutrition assessment tool, the MNA, and also you could see this patient generated subject global assessment. This will also help us in assessing the nutrition status, basically for the people who are having these cancers. Okay, then the energy and protein requirements, these are calculated based on the individual needs and also the different categories of these individuals, and also the fluid needs, and also the formulas. Today we were in a consultative meeting at the district, looking at the right to food. Okay, there are things that there is a bill that is going to be passed into a law of a right to food, but really you could understand that people are only talking about food, but they're not looking at these. They are talking about food security, but they are really looking at only availability and accessibility. But very few people are looking at what are the recommended dietary allowances of this particular food. We could talk of access and availability, but is it enough to meet the recommended dietary allowances? These are key things that we raised, but maybe if the politicians take them up, well and good. If they don't, we are used to that. Formulating a diagnosis, here we are looking at this could include inadequate oral intake. We could talk of hypermetabolism. Diagnosis, we are looking at what is the etiology. Okay, what is the particular cause and how has it been happening? It is more to do with a statement of the problem. Okay. Yeah, and what are those other challenges that are exacerbating it? Could it be the swallowing difficulties, the chewing difficulties? Could it be the absorption due to the altered gastrointestinal function, etc.? And what does it cause? What does it lead to? So what it leads to is what we'll be intervening on using things like modifying the meal texture, increase nutrient dense foods, initiate oral supplements. For example, if then the foods do not contain these particular nutrients, the person has limited access to them. Also provide pain management before the meals, for example, people with the swallowing or chewing difficulties. Remember when we are looking at the dental conditions or the dental disorders, etc. Calorie requirements, this is varied based on the patient's condition, ranging from 21 to 35 kilocalories per kilogram body weight. And also for the protein requirement, we have looked at the elevated protein needs in cancer being 1.5. Really, it is the normal is 0.8 to 1 kilogram, 1.2, 1.2 kilograms per kilogram body weight, but this is still the same. We tend to increase a little bit for the protein needs in cancer for essential cell growth and also for the healing. The interventions and side effects, common side effects include the nausea, that feeling as if someone wants to vomit. Then also we have vomiting itself. Then we have also early satiety, mucositis, the diarrhea, that there is dysgeusia, the xerostomia, the anorexia, etc. For the treatment, we have various interventions such as eating those small frequent meals, like I have told us, avoiding those noxious odors or any odors that could upset this individual, and also considering pharmacological appetite stimulants, and also giving the individual the foods that they would really want to consume a lot. So monitoring evaluations, we are looking at parameters. What are we going to be monitoring for? The weight, then the calorie intake, and also tolerant diets, and also the changes in symptoms, and also the signs. Aspects to be scored on this patient-generated subjective global assessment that suggests problems, and also set those measurable goals that can be easily achieved by an individual. Really, we have looked at a lot of things to do with the cancers, how we develop the different forms of treatment, how the nutrition plays a key role, and we've also looked at the nutrition care process in this. Our friends try to do as much reading as possible on this because it is now it is trending. Cancer is trending. People are getting cancers of different kinds. You as a nutritionist, don't limit yourself to working in a refugee setting. You have a cancer unit in almost all these big hospitals. Go there and offer your support and offer your expertise. Actually, it would be good because most of these symptoms you will see them. The people have the diabetes, but they will also have the cancer. They will have the hypertension, but they will also have the cancer. So if you could get chance to help you go and position yourself in one of the facilities that have these cancer units, you will get a lot of information and a lot of insight and a hands-on practice. So, friends, this is what I have for you for today's engagement. Fingers crossed, people read hard, and make an impact out there. I beg to end my engagement here unless there is something from you. Was I audible?
Thank you so much. For me, I have no question.
All right, Tito. Since there are no questions, let's meet tomorrow. You have a good night.
Thank